As the pressure grows on the NHS today, experienced health professionals have ratcheted up the pressure on the government. NHS providers representing health workers on the front line today said without more money, the NHS would not be able to deliver safe, decent levels of care.
It's a watershed moment because we need to see sustainable funding for the NHS over the long term. What's happening at the moment is a symptom of the pressures in the NHS overall. So winter pressures come every year. We have to tackle that. We need more investment.
Today, 68 senior A&E doctors wrote to the Prime Minister to say the NHS is severely and chronically underfunded. They continued, some of our own personal experiences range from over 120 patients a day managed in corridors, some dying prematurely. An average of 10 to 12 hours from decision to admit a patient until they are transferred to a bed.
I think they need whatever they demand now, immediately, to get through this particular crisis, and they ought to get it straight away. The Prime Minister said on December the 20th that she was satisfied that all the necessary preparations were made to deal with the winter crisis. 3 weeks later, we've had 3 weeks of crisis. Money's got to go in now.
The Prime Minister today said more money had gone in, but she wasn't promising any more.
There have been a number of measures that we've taken that have helped. For example, for the first time ever, urgent GP appointments being available throughout the Christmas period. That was a decision taken to improve the service for people, but also to ensure that the NHS had that better capacity to deal with these winter pressures.
But the debate's growing, even on her own side, about how to find new ways to raise money for the NHS. This former minister thinks national insurance should become national health insurance.
We are going to have to put your national health insurance up over time. Not dramatically, but over time it will have to go up. But you can be guaranteed that that money is going into the service and not going somewhere else. That, I think, will make a big difference.
There's growing agreement more money is needed to tackle the NHS and social care problems. But getting agreement on where you find it, well, that's more difficult. Andy Bell, 5 News.